Injectable vitamins are an intriguing topic in modern healthcare, offering targeted solutions for various nutritional deficiencies. Today, we'll dive into essential questions about their use, exploring how healthcare providers decide when injections are necessary and the potential side effects to watch for and the latest advancements in this field. We'll also consider the role of lifestyle factors in a patient's vitamin needs, shedding light on the intersection of nutrition and wellness. Joining us this morning is Dr. Jenina Escalderon. It's a beautiful day, Dr. Jen. Good morning.
Good morning,
Thank you for
everyone.
coming.
Thank you for inviting me.
So, Dr. Jen, I find this topic very ironic because as somebody who doesn't like injections, I literally pass out when I see them. It's funny that I'm leading it. I had no idea that vitamins come in injectables. Can you talk about, normally people take it orally. So what's the difference?
So you can take oral and IV medication. So when you're taking oral medications, there's a certain limit per capsule. So you can't take so much capsules, right? So there are patients who have immune deficiencies, or there are patients who have absorption problem, and we have to give them via IV. So that's the difference. So they don't have to go to your gastrointestinal tract. You don't get to have irritated stomach or bowel. So you can directly have your nutrition via IV.
Okay, because that's a thing now. I see that everywhere. I mean, I actually tried that once. So would you say to do that more, the IV drip versus taking oral medications?
So it's more of a debatable topic. So for you, if you have difficulty for finding your vein, so it's better for you to have an oral medication. There's actually a sublingual medication right now. So it means that you don't really have to go to your, the medicine doesn't have to go to your intestine. It's more of, it directly goes to your bloodstream. It goes under the tongue. So there's also an IV medication. So these are for patients who are immunodeficient patients.
Okay, that's so interesting because I know a lot of people, there's a lot of misconceptions about IV drips. What are the most common ones, Doc?
So the very common one is the IV glutathione. So people think that when I do the IV glutathione, I want to get white, I want to get fair. But usually IV glutathione, it has been in the market for like more than 20 or 30 years already, and we have been using it for detoxification. And people, maybe they just like the side effect because you get to be fairer or whiter, so people tend to overuse it.
Now, speaking of side effects, Doc, I have a question. Like, other than the possibility of Monique, say, if she got an injectable vitamin and passing out, what are other possible side effects of injectable vitamins?
Okay, so if you have very high doses of IV vitamins, it can have malabsorption problem. It can affect your, of course, you can have nausea or vomiting, and it goes straight to your neurocognitive function. So we don't really recommend you overdosing for it because you can have liver and kidney problem as well.
And how do healthcare providers actually actively monitor the benefits of these injectable vitamins?
So you can do a laboratory testing for that. So we have testing for vitamin D deficiency, vitamin D, and we usually test the patient, clinically assess them. What specific IV nutrition are they lacking? What specific IV nutrition do they need? So you have to check their neurological function, yung sa brain. Is this patient having dementia? So they might benefit for vitamin D na mataas na dose. Or do they have hearing problem? It's also one of the controversial topic now. So we usually give high-dose vitamin D as well for patients who have hard of hearing because they have really little supply of nerve, like a nerve supplement or nerve power to their ear.
You know, you're talking about all these tests, Doc, that you need to undergo to determine if you need a particular injectable, right? But you are seeing a lot of places, a lot of clinics that offer these drips so freely, right? I mean, I've tried doing the IV glutathione drip with the collagen and the vitamin C and everything.
Did it work?
I'm not really for the whitening benefits, more of like the wellness, right? That's why I take these strips. But you see these places, they normally would just give you that list where they ask for your medical history, your allergies. Do you think that this needs to be regulated more? Because now it's just really easy to get drips anywhere.
Yeah, it's just like a trend
Yeah,
right now.
So
yeah.
actually, these medicines, they are really FDA regulated. So you have to be
Okay.
sure that your clinic is an FDA provider. All medicine, there's this accrediting body, and we have to make sure that a doctor does it, or your medicine is really from an FDA approved supplier. So
Okay.
there are a lot of medicine right now in the market, IV medicines particularly, that causes you to have seizure. I don't know if you've heard of that. If they're injected in the wrong way, prepared in the wrong way, it can really be fatal for the patient.
That's so scary.
That's scary.
Yeah, so
Yeah.
it's really a trend now that there's a lot of, well, other people injecting, especially having it injected with non-medical professionals. It's really scary because you can have, well, you can be brought to the hospital, you can have seizures, yeah, so it's really hard. So you have to make sure that your provider is well trained, of course, that when they're injecting it, they know how to correct it as well.
Yeah, and speaking of trend stock, aside from the IV drips, I know right now the other trend is the weight loss injectables.
Yes.
What are your thoughts on that?
Okay, I'm all for it because it also has been in the market for like 10 to 20 years already then. So diabetic patients have already been injected with GLP-1. The thing is, now it's being used as a weight loss medication because they found out it's a side effect as well. And it's really not a problem for some patients, but you have to start with a specific dose. So there's a patient that if you inject too much, they can have weakness. So as in super weak for like 1 week, you cannot even walk. You cannot even,
yes,
yes. And when you see food, you feel like you want to vomit. So yeah, so there's a specific dosage when you start this medications.
that's so
then
scary.
yeah, every week we have to do increments increase for that, and we have to do monitoring for that patient.
Okay, so basically, long story short, go to a professional like
Yes.
doc.
Yeah.
Okay,
Yes.
that's crazy.
Yeah.
Do the patients have to present a medical certificate before they can get these weight loss injectables?
Okay, usually you have to go to your general physician, to your obesity physician, or your lifestyle medicine physician. So they have to check you before you undergo this procedure. Me, when I do this kind of procedure, I always check the patient. And I always tell them, oh, this is the possible side effect, and you should take note. If you feel very severe symptoms, you have to go to the hospital, or you have to contact me immediately so that we can reverse it. I can help you with it.
Let's see. So like what kind of role does, like these are all the medications going in, but like what about if I'm as a patient, my lifestyle, how much does that factor in to my receiving an injectable vitamin?
Like for you, you're an immunocompetent individual. So it's more of if you have difficulty with your fatigue or sleeping, or if you want to have more collagen in your body, so maybe you can consider it as a supplement rather than something that you do regularly. Yeah, so you can do maybe once a week.
Once a week.
Yeah.
Okay, now aside from injectables, doc, what vitamins orally do you recommend for our viewers to take every day and for us to keep healthy?
Okay, definitely vitamin C with zinc. So very important that you have this zinc component inside because it helps your skin and nails as well. And then what else? It also helps you with your immune system response. So it heightens up your immune system. And then, maybe that's the very essential vitamin. Yeah. The
Vitamin C and zinc. Do
Maybe
you
B as
recommend that it should be taken orally, or is it more effective to have it injected?
Yeah, exactly.
Well-
Like, how do you know which to take orally or injected?
Well, if you are immunocompetent, meaning you can tolerate the medicine, so I suggest you take vitamin C orally every day. But if you have, I have some patients who have difficulty, they have stomach pain or they feel nauseated when they have this kinds of vitamins because it's a fat-soluble vitamin, right? So you have to do it via IV. So these are usually for patients who have cancer. So there's studies now that when you give high-dose vitamin C for patients who have cancer, it helps them fight off the cancer as well.
Okay.
Doc, is there anywhere that our viewers can find you online if they have any like other questions or if they want to learn more about
They can search
these?
me via my clinic's IG. So it's Una Medica PH.
Una Medica PH.
Yeah.
All right,
Well,
thank you very much.
Thank you
you,
for the
Dr.
wonderful
Jen.
insights. We learned
Thank
so
you.
much
Yeah.
today.
Thank you so
Filling our
much.
minds on a Monday. It's
Yeah.
lovely. Yeah.
I hope
Thank you
it's
so
not too
much, Doc.
much. Yeah.